Now I'm 29 years old. I'm a mother, and my daughter's born. And when my daughter's born, she had a hard time like latching in the hospital, but then the lactation consultant came and she like was fine for that moment. And then we got sent home. I could not get her to latch. We just didn't know what to do. So we figured, we needed her to get fed. I would try and breastfeed her. She would fall asleep. We would get her like naked, undress her, try and wake her up for these feedings. She would not stay awake during these feedings. So I'm like, okay, what do I need to do? Ended up pumping and then feeding her from the bottle. The bottle, so she was bottle fed. And then with her story, she was really gassy, extremely gassy to the point where like I just knew that she had a gas bubble. We'd set her down and then like 5 minutes later she'd wake up just screaming. We thought she was asleep, right? She'd wake up screaming and I'd pick her up and then she'd have a burp. She'd have a gas bubble. We just were like, what do we do, right? Something else about her. Okay. She was pretty gassy. She spit up. Like I said, she burped a lot. We always had to have a birth cloth nearby, bibs nearby. We used like the Tommy Tippy bottles. That was ones that worked well for us. I tried the Dr. Brown's bottles and it was just coming out like way too fast for her. So the Tommy Tippy bottles were working well, but then she couldn't really get the milk out. It was good because it would stop the milk, but she couldn't really suck it out. Now we know it's because her tongue wasn't really working well. So what I did, not knowing what I know now, right? Took the scissors to kind of open up that bottle nipple to give her a bigger nipple. So then the milk would just kind of pour in her mouth and then she just would have to swallow it. Really, her tongue wasn't having to move and suck the milk out, which is why breastfeeding is important and why some babies can't breastfeed is because the tongue really is doing the work on sucking the milk out and getting the milk out. Now, some moms have a great supply. Sometimes the supply just comes out. But then around like 3, 4 months is when the supply gets more regulated, I believe. So if the baby hasn't been working and sucking as much at the breast, then that's when the supply may possibly drop off. I knew a little bit about tongue ties because my niece had previously been diagnosed with a tongue tie and got that released. So I had asked our pediatrician, I was like, hey, like, is there a tongue tie? Like, I can't breastfeed her. She's really gassy. He says, oh, there's like a little bit, but she's okay. Keep going back for these checkups and she's hitting her weight checks fine, but I'm still telling him like, hey, I think she's tongue tied. I think she's tongue tied. I think she's tongue tied, thinking like I need a referral from him or something. Like, what do I do? Where do I go? Right. And nothing. Then I kind of like stumble upon some Facebook groups and find more information about tongue ties, where to go for the different providers and whatnot. Come to my daughter's 3 month appointment, see the pediatrician, and he's like, yeah, she's tongue tied. Like, why haven't you done anything about it? Like, exactly what a mom wants to hear, right? I had been asking and asking and asking, and guess what, you guys? Like 2 weeks later, I was supposed to go back to work. So we go see the specialist in ties in our area. And she's like, yep, she has a tongue tie, lip ties, cheek ties. She had pretty big dimples, right? Just like her mama. But they were like, okay, so they recommended doing some therapy prior. Not knowing what I know now, we did one feeding therapy appointment and then got her ties released because I was going back to work like 2 weeks after that. So got her ties released. It was amazing with the specialist as a body worker in practice really looks at the full body approach, right? We did the stretches with my daughter. And then after about like closer to 2 weeks, kind of backed off on the stretches. Busy at work, working parents didn't really understand the full connection of everything. She was still taking a bottle. She continued to feed from the bottle for a year, and it was so much better. She was way less gassy and just slept a lot better as well. I could tell she was such way more happy of a baby, right? Then fast forward when she's 2 years old, then she starts talking more, closer to 2.5. Then I notice that like a stuttering is coming in. So I'm like, okay, this is something I think needs to get addressed. Maybe this is why like we should have done possibly more of the therapy. I know we didn't do the therapy before as much for tongue tie release or after, but that's when I went back to our pediatrician and for I asked for a referral to a speech pathologist. And I asked for a referral to a specific place because depending on your insurance, I believe have you have to ask, you have to have them have the specific place on the referral. I know this from working in the dental office and whatnot. So I have them write the referral for the place. And I mean, they did it thankfully, but he was like, she's talking great. Like, yeah, she's stuttering, but like, I think it's normal. I was like, I want a referral. I would like a referral for speech therapy. And she started doing speech therapy once a week, I believe it was. And it just helped a lot. She sat in the room, she listened to the speech therapist. I learned a lot more as well. And then that's when the speech therapist brought on the recommendation of possibly doing an occupational therapy evaluation. I had no idea what occupational therapy like was, right? Being in the health field, I still just didn't really understand what it was. I had a couple of friends that were specialized that went to school for it, but I didn't really know what occupational therapy was. I'm like, okay, we'll look into this a little bit. Then my daughter started doing occupational therapy for a little bit of low tone, fine motor, and gross motor skills. That just everything, integrating everything in the full body system, wonders on her. So, with occupational therapy being recommended for my daughter, then I learned more of okay, what are primitive reflexes? All right, the tongue tie, it's the deep line of the fascia, the core. Sometimes there's low tone involved. So, we really want to strengthen the core there. It's just opened my eyes to even more of the full body approach, too. Um, she's now 4.5. We've been continuing with occupational therapy. She's doing her myofunctional therapy exercises. We, the speech therapist, we graduated where we were at that time. And she said she wanted to see her back when she was about like closer to 5 years old to see where she was then. So we're kind of at that point now where we're waiting to see like, are we needing more intervention or not? Which with the myofunctional therapy we're integrating in, hopefully not, but if so, we'll do it, right? Like I said, I was in speech therapy all through elementary school, right? But just knowing now, I wish I knew then what I knew now, but you don't know. That's why I'm here, hopefully educating and helping you all. So those are different things that we can look at. I don't see really like babies. I can go and do an in-home evaluation and help guide you with providers in your area. We can also possibly do like a virtual evaluation of some sort and set up providers in your area that can help you more so with that. And usually my functional therapy is about ages 4, sometimes ages 3, depending. You can start implementing the exercises when you know your kids are listening more attentive, sticker charts, those kinds of things there. My daughter, like I said, she's 4.5 now. We've been doing our non-functional therapy exercises. Sometimes she'll be like, Mommy, I was breathing through my nose. Like she just knows like positive reinforcement, right? We do little things like putting the popsicle stick in between her lips when she's watching TV or just coloring, trying keeping the lips closed, breathing through the nose. Um, just the other day, she was able to hold her tongue in that suction for like a couple seconds. I think it was like I had her do it for 10 seconds. So that was really great. It was something we've been working on. She's like, Mommy, you always talk about mouth stuff, but really, she understands that it helps keep you healthy as well. That's just what I hope for you all and future generations is to know that you can ask. You can ask your pediatrician. Sometimes your pediatrician doesn't know. You can go to the providers that do know and ask the questions, please. When you are looking to get a tongue tie released, myofunctional therapy is so important. And it is so important to be doing specialized myofunctional therapy with a therapist all through the process. There is so much that you need to be working on. I've known from seeing my daughter not really doing any feeding therapy before and after, seeing different patients, right? Then seeing my son where we did the feeding therapy before and after, and then different patients where they had done the therapy and the different results and everything. And it is so imperative to be working with a myofunctional therapist through the process. Let me know if you guys have any questions.